My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
My name's Andy. I've had Crohn's for over 10 years, and I've had permanent ileostomy for 3 years now. So my next question is kind of along with mental health that is underrated, is also chronic fatigue. Tends to be a very debilitating part of IBD that a lot of patients feel and live with every day, but it's very understated in their treatment plans, or even doctors are just like, oh, I'm sorry. And so I'm just wondering if you have any recommendations for people that are diagnosed or living with IBD on how to kind of combat this beast of chronic fatigue, just to be able to have a better quality of life.
Yeah, fatigue really is it's a complicated beast because you can have a lot of different issues that contribute to being fatigued. Certainly patients with a lot of inflammation happening in their body because of all those inflammatory cytokines that are kind of being released can have fatigue. There are other factors that I think people should be mindful of as well. Going back to mood, that's really important. People may not realize that, I'm feeling really fatigued, but also, my mood in general is kind of low. I'm not as excited to do things that used to excite me. I'm getting less sleep. Those could definitely be linked. Feelings, a lot of people with early signs of depression or late depression can definitely have fatigue. Having low blood counts can also contribute to fatigue. Having low thyroid hormone can contribute to it as well. And obviously having active IBD, being in that kind of high inflammatory state. Those are just to name a few. So I would say if you're having fatigue, it's definitely important to mention it to your providers because there may be correctable or reversible causes of it. It may not necessarily be 100% directly related to what's happening in the colon. There may be a nutritional component to it as well. It's very difficult to treat. There isn't a one recommendation fixes everything kind of solution to things, unfortunately. So it may require a few tries. It may require kind of an initial diagnostic workup at the very least, blood tests. But I know it's really a source of disability for a lot of our patients. And if it is a source of disability, and if it's something that's concerning to you, don't give up. Talk to your providers, get to the bottom of it, and there are always things that we can consider, and there are always things that we can kind of do to help you feel better.
I was going to say, I know that diet and exercise also play into kind of boosting those endorphins to get you more energy and everything. What would you recommend for somebody, say their fatigue is just kind of, they're having a low point? How do they kind of get into that energy where they can even just do basic day-to-day things, I guess? There's people I know that they know they have fatigue, their doctor knows they have fatigue, but it's just even just getting up to get dressed, to boost that mood, even to just get moving.
Right. Right. Again, there's no one size fits all. It really depends on the cause, but let's just assume, let's go down the rabbit hole. You're feeling fatigued, you've had IBD for years. This is something you've been struggling with. A kind of preliminary medical workup hasn't really revealed anything. You're not necessarily going through a flare right now, but you just feel like, bleh, you wish there was something else that you could do. I think you've named a few good things, staying active, whatever that is. And they're very different for different people. Some people are the kind of I used to enjoy running. I used to, do this or that. Being active is definitely important, definitely impacts mood. The diet component, eating healthier, well-balanced diet, again, avoiding those processed foods is also really important as well. A lot of my patients really benefit from mindfulness meditation. I haven't delved too much into kind of the objective literature of, the benefits of mindfulness meditation with regard to IBD, but I do know that it really helps people, particularly with diseases like irritable bowel syndrome, which frequently overlaps with inflammatory bowel disease as well. Starting your morning with a little bit of mindfulness meditation can help, and there are a lot of apps out there and audio files that help people kind of guide through the process of mindfulness meditation. That can sometimes help kind of just start the day off in a really positive way. I usually start from there and really kind of work with the patient and what they're used to. Some patients are like, there's no chance in heck I'm doing mindfulness meditation. I just want something kind of quick and easy. And then you kind of have to delve a little bit further, like, well, what did you used to do? Why aren't you doing it again? Things like that. Yeah, so it can be kind of a challenge sometimes, but it's very much individualized.